Coming up today, a grateful patient shares how this team of nurses got her through one of the most painful times in her life. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. It was February 7th when Becky Smith thought she was having a heart attack, but it was something else causing her pain, and it would require emergency surgery and a lengthy and often painful hospital stay. She recalls it was more than the medicine that got her through this difficult time. And we're so glad Becky joins us in studio today, healthy and ready to share her gratitude for the team of nurses who got her back on the road to recovery. So good to see you doing so well today.
Thank you. I'm happy to be here.
Well, sometimes it takes a village, as they say, and Becky, you were surrounded by no less than 15 caregivers during your stay on Unit 51, including hospitalists, physical therapists, but you credit this big team of nurses that really got you through.
Yes, because they're the ones you have most contact with.
Yes.
And in the hardest conditions and when you feel at your worst. Yeah,
and you created quite a bond, and we're going to find out why here in the next 30 minutes. And I want to welcome to our studio today night shift nurses Samantha Heineck, Jordan Galvin, along with day shift nurse Abby Monahan. Welcome, ladies.
Hi.
Joining us upstairs near Unit 51 this morning, Ellie Rivara, Monse Raya, and nursing associate Chandler Finagi. Welcome to all three of you today.
Hi, thank you. Good morning.
Good to have you with us. So Becky, take us back February 7th. Why did you think that you might be having a heart attack?
Well, in the past year and a half, I've had some heart issues that I never had before. I mean, they came as a total surprise, and I ended up having a pacemaker put in last May. So I had also read a number of articles about how heart attacks for women manifest much differently than for men, and were only beginning to be investigated, really. And one of the things was it could be stomach issues that would precede a heart attack. Because I had no other stomach issues at the time, that was what occurred to me. So I actually contacted my chart and just said, "This is what I'm feeling." It could, and I was told, get to the emergency room.
Well, that was smart, because you're right.
Yeah.
Those symptoms can be tricky for women when it comes to heart issues. So you go to the emergency department. You find out this pain is from a bowel obstruction. What did they tell you needed to happen?
Well, initially, there was a question about what could have caused that. And after a long period, they came and said, and my husband and I both thought, oh, it's kidney stones. He had actually been in here about 6 months prior with a kidney stone, which was really mysterious too. And finally, that was the determination. And I have had them in my past, although not for years. But that was kind of the pain it was, like a really severe cramp. So when they said it was a bowel construction, that came as quite a shock. And what they determined was that an earlier surgery on my colon had resulted in scar tissue that just closed up the opening, I guess.
Well, Dr. Jennifer Hartwell is the section chief in emergency general surgery. She was your surgeon, and here is what she had to say about your case.
So what we found in Becky's case is there was an adhesive band or scar tissue that had formed because of her prior surgery. So we found two areas of bowel that were sort of stuck together. We were able to free up that scar tissue, and then we found about a couple of inches, maybe 3 inches of bowel that was not viable. And we had to take that section out and then put things back together again. A lot of patients ask, what can I do to prevent the scar tissue so this doesn't happen to me again? And unfortunately, we don't have anything that we can do to prevent this. This scar tissue is just the body's way of healing. There's no diet to follow, no exercise we can do to prevent the scar tissue. It just happens. So the most important thing is when patients have symptoms, nausea, vomiting, pain, unable to use the bathroom normally, need to come in and get checked out, because those are early signs of an obstruction that we can intervene on.
After the surgery, that is where the real healing began on Unit 51. Becky, you wrote to us that the atmosphere on Unit 51 is what every hospital strives to create. This group deserves every accolade. Can you describe the atmosphere you spoke about for us and how it helped you in your recovery?
Well, it was just a generally favorable atmosphere. I mean, they all seem to work so well together, be dedicated to their jobs, and take extraordinary care with all the patients. And that's what I found in dealing with them myself. I mean, attention whenever I needed it, and a sincere desire to help me get through it and to ease my pain.
All right, there was a night shift nurse that stood out for you. This was the first night post-surgery. You said that Jordan was there on my worst night. She was very patient. I knew I was being rather demanding because I was in a lot of pain, and she did everything she could to help me. So Jordan, what do you remember about that night? About this demanding patient?
No way was she demanding, but I do remember prior to surgery, she was in a ton of pain. The NG tube that she had, it was giving us nothing. Pain meds were doing minimal work. We even tried walking, which is one of her favorite things to do, and we could barely get anywhere with her. Ultimately, when I came back the next night, I found out she did have to have surgery, which I felt terrible for, because we really don't want our patients to go that route with the obstruction if they don't have to. But upon walking into her room the next night after surgery, she was full of life, full of color, and to her, I was so apologetic, and she's like, no, I needed this. I went with this, and this is what I decided to do, and I feel better. And after that, she was up like running around the unit. She was a different person.
Well, Becky says you even researched different pain medications at one point. What were you trying to do for her?
Medications.
Yeah, oh gosh, yeah, we tried every pain med we could pretty much that her body allowed. I think we got up to like Dilaudid IV, which that barely did anything for her. We did, melatonin. We even tried Atarax, which is like an anti-anxiety med, which also helps put the patient to sleep, and she was barely getting any sleep with it, but it was the surgery.
It just shows that every patient's different. You've got to try different routes.
Yeah.
Samantha, research shows pain is often worse at night. Why is that?
I think it could be a lot of different things. I think some psychological aspects to it, because there's less distractions at night. There's no visitors. Fewer people are coming in and out of the room, hopefully. And then also things like cortisol can also affect how you are feeling pain.
Becky, you told Samantha that she looked young for her age. That was a compliment that was pleasant during an unpleasant time. Is this what I understand? No, that's never wrong to say. That's always a lovely thing to say to somebody. How did that help you?
Are you asking me?
Yes, how did that help you?
Well, it just came so unexpectedly. I mean, of course, you feel at your absolute worst when you're in the hospital and dealing with pain and that. And just to have someone give you a compliment, I mean, it was just had an enormous effect.
Yeah, that'll put a little spring in your step.
It does.
So speaking of step, Abby, Becky says that you were big on her walking what's called the auto path. What's the auto path, and why did you want her to walk it?
Yeah, so our unit has a sign. There was a patient that used to walk laps around the unit. That's the picture. So 20 laps around our unit is 1 mile. So the more you're getting up and walking around, the better you're going to be for, after surgery, you're going to get things moving a lot quicker. And also just getting out of your room.
Right.
Like you get so confined to the 4 walls you're in. So it is nice to get out and you get to see your nurses who maybe took care of you 2 nights before or what have you.
And actually, for some kinds of pain, I mean, it is a relief to walk.
I bet.
Yeah. So you feel better walking.
Getting out and about, feeling like you're getting back to.
Right.
You feel like you're making some sort of progress.
That positivism too, as well.
Well, let's speak to our group upstairs. Ellie, Becky says that you and all the nurses were so responsive, so sweet. How do you, how the question that they were wondering is like, how are you doing this to all these patients? You're caring for so many patients all in one single day. How do you do all that?
I think it's important to try to make a connection with every patient that you have. Just chatting with everybody really helps you get to know them as a person. And I think that if you bring a little bit of warmth in, especially in the morning, and that you have a connection with each patient, then you can kind of work together throughout the day to get what they need. And then with the way that we work and all the different patients that we have, I really think that having this group of nurses work together helps us throughout the day, because I really love and enjoy all the people that I work with. So it helps when you have that team kind of on your back, helping you out to get you through the day.
Yeah, making a connection with the team and with each patient each day. Chandler, Becky remembers you helping her with a really important milestone, her first shower after surgery. How important is it to get patients back to their routine, especially something as that we might all take for granted, just taking a shower each day?
Yeah, I think that's one of the coolest parts of the jobs that we get to do as NAs and as nurses, is helping these patients get back to their routine like that they were in before they were in the hospital. And I think Becky's kind of helped remind us of something like really important. Like, we know that when we're doing things like giving showers or like helping a patient stand up again or helping them walk around the unit, we know that we're helping them like physically, but I think Becky's been a good reminder that like we're also leaving a positive impact, like, you know, mentally, which is a really nice reminder, because sometimes when you do things, you know, several times in a shift, you can kind of forget the different kinds of ways that you might be impacting a patient. So I think we're grateful that Becky's kind of brought that to our attention again.
Sure, and the bond you feel when somebody is helping you shower.
You're so thankful.
Yeah,
and you feel so awkward, and of course there's the fear that you might fall or stumble or whatever, and yeah, just to have someone so at your side is,
to know they've got
wonderful.
you.
Yes, exactly.
Well, and just that normalcy, just feeling good. And you said that this was the first time being in the hospital for this amount of time. How
Right.
long were you there? Do you remember?
Maybe 9 nights, 9 or 10, yeah.
Monse, you met Becky the day of her surgery and cared for her for several days. What do you remember about the day that you were able to send her home finally?
Yeah, she was actually still walking laps around the unit, even on her last day. And I think a lot of us were really sad to see her go, but very, very excited for her, because she had been with us, you know, for a little while, and a lot of us got to take care of her and form a connection with her. And then I remember I actually thought Becky had already left the unit, and then she actually walked back in, and she asked to take a picture with us, and she hugged us before going home, which is always really rewarding, having a patient come back up and, you know, want to take a picture or just say thank you, and hug the nurses and like show their gratitude.
You're having trouble letting go. You're wanting to stay a little extra longer. You already missed them, right?
Keep them in my regular life.
That's right. That's right. Well, maybe some of you at home, could relate to Becky's story, and we would like to hear your questions for her, or maybe some of the nurses here on our program today. You can use the chat on YouTube or Facebook. You can email the Medical News Network. All of that information is there on your screen. Becky, you were kind enough to share some photos of your family. Are you able to be feeling well enough to get back to doing the things that you love and enjoy?
Oh, absolutely. Right. I would say I'm fairly normalized now. So yeah, most of my activities are what I was doing before. There is some discomfort, but yeah, it's proceeded pretty well. So yeah, I'm pretty much back to our routines.
Abby, Becky remembers, and you were just talking about it before the program began, talking about your cat. You were sharing stories of your cat. Just sharing a little bit of personal information and bonds like that. Does that help with your connection with your patients?
Yeah, I think it was you who pointed out I have a badge reel of my cat.
It was my husband.
Okay, yeah. And I was like, let me tell you all about her. I think it gives a slight distraction as well of like, okay, yeah, we're here in the hospital and we're here for this, and I'm so glad we get to treat you. But also like, oh yeah, let's talk about something other than that. But yeah, I find like sharing those connections and those stories also helps me and you form a relationship, feel more human.
Absolutely, it does.
Yeah, and then you get to, when you're walking laps, and I get to show you a picture of her, like, it's
right.
just, yeah.
You're like, don't start with me. You bring up my cat. We can be here all day, right?
Yeah.
That's great. I love that. Well, nearly 20 years ago, the University of Kansas Health System became the first hospital in the state of Kansas to achieve magnet designation. It was no doubt something to celebrate in 2006, again in 2011, and then again in 2016, and then once again in 2021, when our designations were all renewed. Magnet status is awarded by the American Nurses Association and recognizes nursing excellence and the role our nurses play in giving care. Fewer than 8% of all U.S. hospitals have attained magnet designation. And I would like to ask each of our nurses for just a quick comment on how being a magnet nurse influenced your care for Becky. And Jordan, I'll start with you.
Yeah, I actually just graduated from our nursing residency program here, and so I got to meet a lot of different programs in the hospital. So knowing those people, I was able to reach out to other people for Becky, so it helped bring in more teamwork, interpersonal care. So I think it's a really, really great thing to have here.
Abby?
Yeah, we are very lucky to have the resources we have, and I think that allows us to care better for you, whether it's being able to reach out to our, pain team, what have you, but also having just like well-rounded nurses. I think we can all kind of bounce ideas off each other to help you feel better.
Samantha.
Yeah, I mean, but basically what everyone else has been saying, but definitely the resources that we're able to have, the ability to get certifications, that has also helped to like further our education and help us to provide care to more patients.
Monse?
I think working in a magnet hospital just makes it more like positive and a supportive environment. There's a lot of teamwork on our floor, and there is a lot of great nurses that have more experience, certifications, all kinds of things you can get with working in a magnet hospital. And I just think we work together very well, and we make work fun, and the hospital and our team is very supportive.
Chandler?
So I'll be graduating in the next 3 weeks, and I think an important part for me about KU being a magnet hospital is that kind of like it makes me want to stay here. There's so many opportunities for growth, so I'm glad that I do get to stay with KU. But I think that's kind of like one of the best parts about the hospital is that it is magnet, and there's so much room for growth and opportunity, especially for people that are like new to the nursing profession or will be graduating soon.
Ellie?
I think that it empowers nurses and it makes us feel like a really valued part of the team. I think being a magnet hospital, the rest of the care team kind of expects nursing to provide a high level of care, and they also have a lot of respect for our opinions and thoughts and ideas for maybe helping a patient. So I think that really makes everybody feel like a team, like everybody's thoughts and ideas can help.
Great, thank you. Thank you for those comments. And I want to get to some questions and comments from our viewers this morning. Question and comment from Jill. She writes in that when her grandson was in the NICU at the health system, the nurses always asked if I needed anything before leaving the room. Did the nurses on Unit 51 do that for Becky's family? It really made me feel seen and acknowledged how afraid we were for our newborn's health. How does the family care come into play and those connections?
I think family is really important. Sometimes when a patient is unable to speak for themselves, family is there. Just showing that you acknowledge the family member, they feel seen as well, not just sitting in the corner to be there for their family member. So treating them like a part of the system as well, it really helps all the care around.
Any comments on that? Do you have those connections with family when you come in contact with them?
Yeah, I also think it makes it easier, or like when you were in surgery and I ran into your husband, I'm like, oh, like how is she doing? Like, but if you help the family, that's also going to help, like you said, Jordan, like they know you best. They know you better than we do. They might be able to have more insight on how we can help you.
And so reassuring to them as well.
Yeah.
I bet. Stuart has a question. Monse, I'll throw this out to you. What kind of unit is Unit 51? We hear the number, but what kind of care happens there?
Honestly, it's a lot of teamwork. I have been a nurse for about 5 years and worked in different settings, and I don't think I've ever been on a floor where there's so much teamwork. We all get along. We like to make work fun. Crack jokes at the nurses station, but it all comes down to teamwork. If I need help and I ask Chandler and it's not his patient, he will jump in and come help me. And that's just kind of all around our unit. Everyone is willing to help, no matter whose patient it is or what they're there for. They're always helping.
And do you care for specific types of patients that have specific types of illnesses?
Yes, so we're actually the trauma floor, so we get a lot of, car accidents or anything crazy you can think of. And then we also have the general surgery floor, which sometimes we get planned lap choles, or for example, in Becky's case, a bowel obstruction. That's typically what we get most patients for on our unit.
Alexis has a comment and question. She says, first, I have a friend who may want to change careers and be a nurse. Do you ever have nurses who join later in life from completely different careers?
Absolutely, all the time. I mean, even on our unit, we've had several nurses join the team who this is their second or third career in life. So definitely not too late.
Never too late. Never too late to change careers. She also just said this is the sweetest program. How incredible that her care, Becky, was so fantastic that she remembers all these faces and what they did for her. So it was important to you to...
I'd recommend it to anyone facing any kind of surgery.
You'll do anything, any excuse to come back and see that. Come back on the show, right?
I should just make a point of it coming in regularly.
I love that so much. Well, I just want, is there anything, what do you want the big takeaway from this program to be? Of all these nurses here and all these people who rallied around to take care of you, you've made all these friendships and connections, but what do you want people to really know?
That whatever you're facing, there is someone to help you get through it. And nurses like these, it can't be overstated how important that is in the healing process. And going forward, knowing it's there for you.
Last question is, can we see a picture of the cat on your badge?
Yes.
I know that you, oh, it actually is an actual.
Okay, this is the badge reel.
A badge reel.
And then I have her as well.
Okay. Literally wear it. You literally wear your life on your badge.
And then my badge reel says, "I'd rather be home with my cat." Yeah. Yeah.
Or taking care of Becky.
Yeah. I'll get that one next. I'd rather be taking care of Becky.
I love that.
But I'd come to see your cat.
Yeah. I wish I could bring her and then we could all hang out.
Okay. Yeah. All right, thank you so much, everybody, for being here, and we appreciate all these nurses coming down to just show support for this one patient.
I'm so pleased that there is a channel for these great nurses to get their recognition.
Absolutely. Thank you so much. Well, we love shining a light on health system nurses. And before we go, check out some of the young minds building an interest in healthcare. About 40 grade schoolers visited the health system this week for a Nurse Explorers Day. It started in the classroom with lessons on germs, anatomy, and different healthcare specialties. But the real fun was outside with events like PPE relays. Kids competed to see which team could don their protective gear fastest. I take it you ladies haven't seen this yet? No. Okay, this is fun. Nurse manager Jamie Bartley brought her daughter Hazel, who said that after this event, she's interested in following in Mom's footsteps.
Yeah, because I really like helping people, and it kind of brings me joy.
Having Hazel be able to see the endless possibilities in healthcare and what's possible for her in the future at such a young age, to me is really kind of a gift.
That was fun, huh?
Yeah.
You got some nurses coming up behind you. Well, thank you again for joining us today. So glad you could be with us. Have a great weekend, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update. As an Ironman triathlete, John Bonsack pushes the limits of his endurance. But what started as a lump on his neck would test a different kind of endurance. I'm Jessica Lovell on the next Morning Medical Update. Surviving head and neck cancer without the need for surgery. The treatment and trial that let John keep working while fighting cancer. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.